Welcome to Taking the Floor, the podcast from Hinge Health about pelvic health, movement, and taking charge of your well-being.
We're your hosts. I'm Kandis Daroski.
And I'm Bijal Toprani.
And we're both pelvic health physical therapists here at Hinge Health. We created this podcast because we believe there's no such thing as talking about these issues too much.
We're here to help you learn more about your body and how our pelvic program can support you. So here's a sneak peek of what it's all about.
This is the peeing when you sneeze, the leaking when you laugh, jump, lift up something heavy, having to go to the restroom all of the time. Things like pelvic pain or painful sex.
We break down the exercises in your program so you learn more of the why behind them.
So a hill that I will die on as a pelvic floor physical therapist is that Kegels should not be the only exercise. We share the stories, struggles, and successes of fellow members.
I felt like my body wasn't working for me anymore. It made me feel like I was aging faster.
We just kind of live with it because that's what we're taught to expect. So that's what I did for years.
So I went from being able to really not run much at all to running 5 miles if I want.
What I know now that I wish I knew before could probably fill a small book.
We provide a ton of tips for better pelvic health that you can start right now. No topic is off limits, and we feel passionate about creating a safe space to talk about things that can be embarrassing or uncomfortable.
When you have someone fill out a bladder diary, you have so much objective data, boom, right in front of your face.
Yeah, and I'm sorry, I gotta jump at the chance to give you just like a hot little tip right now about this.
Then I always joke about how TMI is out the window.
It's not a joke. It's not something you have to live with. You can overcome this. You might have to challenge yourself a little bit, but you can absolutely get there. And you should.
We want to raise awareness for how pelvic floor disorders affect people, and yes, reduce the stigma around talking about them. But we also want to show that these conditions are treatable with the right care, and they are so worth doing something about.
Check out our Hinge Health app library for new episodes coming soon.